on to the last couple things for this particular chapter. We're finishing up with the exercise, nutrition, hormones, and bone tissue. So for this one, we're going to talk about the effects exercise, nutrition, and hormones all play on bone tissue and bone health. So let's talk about exercise first. Now, exercise causes what's called mechanical stress. Usually we think stress, we think something bad, but stress is not always a bad thing. We're talking about just putting the body through a little bit of a test, right? A little bit of impact. And so this mechanical stress that we experience when we exercise actually stimulates more calcium, more mineral salts, more collagen being deposited and built up in the bones. And that's going to lead to healthier bones. And we can see that in people who exercise regularly, right? We're talking that they exercise regularly, meaning a couple times a week, right? For a reasonable period of time, like 30 to 60 minutes at a time, at least. Those people are going to have thicker, healthier bones than someone who is sedentary. What does sedentary mean? Means that you're generally not really moving much. You're not exercising. So someone who exercises regularly, maybe they go to the gym a couple times a week, maybe their job has them up on their feet, right? So they're walking around or they're having to perform some sort of manual labor. That person is going to have healthier bones than the person who does not go to the gym, doesn't work out at home, and generally sits at a desk for their work. That is going to be the thing, and it's not just bones, but that's something that can and does hurt a lot of people's health by being sedentary. Resistance training is one of the best ways to improve your bone health. However, any exercise is better than none. Even walking is going to be helpful for maintaining bone health. And the reason we need to maintain bone health, especially when we are younger, is because as we get older, we will inevitably face bone loss. It's something that is just going to happen. However, if you exercise, you have built up more bone and you will experience a slower rate of bone loss. So you keep more bone for longer if you exercise. If you don't exercise, you lose bone a lot faster, which can lead to something like osteoporosis. Osteoporosis is a weakening of the bones that can and does lead to fractures. And when we're looking at elderly people, fractures can mean the difference between living a much longer life versus passing away within the next year. There is a strong correlation between longevity and how, mortality and if someone has experienced a hip fracture in old age. So exercise is extremely, extremely important. Right? You don't have to do resistance training. You can do any form of exercise you like as long as you are doing it. Nutrition also has a major impact on bone health, namely these nutrients we have here: calcium, vitamin D, vitamin K, magnesium, fluoride, and omega-3s. Calcium, that one stands out obviously because the matrix of bone is made of calcium salts, and so you need calcium to build those calcium salts. Vitamin D is because you need vitamin D to help absorb the calcium from the foods you eat. You can get vitamin D from the sunshine, right, from UV light, but you can also get it from the foods you eat. And this is also why a lot of times if you see a food that is fortified with calcium, it also has added vitamin D so that you can actually get the calcium that they added into the food. Vitamin K also plays a role in helping bones mineralize. It may also help the vitamin D with the absorption of calcium. Magnesium and fluoride are both structural components of bone, so you need them because they're physically found in bone. And then omega-3s, these help reduce inflammation that could interfere with osteoblasts being able to build bone properly. So if you remember when we were talking about the integumentary system, we talked about vitamin D a little bit, especially when we were looking at things like melanin. We're going to review that really quickly. Now, it's important to note, you can make vitamin D in your skin when you absorb sunlight, namely UV light. However, that's not permission to go out and tan. You don't need to be outside very long to be able to get what you need for the day. You can also and do get vitamin D from the food you eat, as well as supplements if you choose to take supplements. Now, keep in mind it's generally better to get your vitamins and minerals from the foods that you eat rather than from a supplement. The foods that you eat generally are going to be in a form that is better for you to absorb. Supplements are also not nearly as well regulated as medications. And so while they're not allowed to be harmful, there's no guarantee that you're actually getting a form of that vitamin that's actually really beneficial or helpful, nor are they really scrutinized in terms of is the proper amount even found in there. So just keep that in mind. Some supplements are fantastic and others are kind of cruddy, but it's really a gamble. You have to do your research if you do choose to use supplements. Once we've gotten that vitamin D turns into calcitriol in the kidneys. This is an active form of vitamin D. In the liver, it becomes calcidiol. That is going to circulate in the blood as vitamin D, and we can use those both to then help absorb the calcium from the foods that we eat, as well as calcium from any waste products that make it through the kidneys. Hormones also have an impact on the bones, the biggest one being growth hormone. This is just going to cause overall growth, right? So increase the length of the long bones, increase mineralization, increase bone density, right? Overall just bigger, better, stronger bones with growth hormone. And we get a lot of that, like especially when we get to like puberty. Thyroxine, this is going to be one of your like metabolism-based hormones. This is going to help stimulate bone growth and stimulate the matrix being formed. The sex hormones, so testosterone, estrogen, progesterone, those guys, those are responsible for the main components responsible for your growth spurt during puberty. And they also are going to be what are going to help convert your epiphyseal plate to the epiphyseal line, basically turning your growth plate off. So once you've grown and your growth spurt is over, we can stop the lengthening of the long bones. Calcitriol, again, this is going to help you absorb calcium and phosphate from the foods you eat. And then parathyroid hormone and calcitonin are going to work in kind of opposite of each other in maintaining the blood calcium levels. So parathyroid hormone, or PTH for short, this is going to stimulate the osteoclast to break bone down to capture calcium from the kidneys, and so overall, and then capture calcium through the small intestine from foods. This is going to overall increase the calcium levels in the blood. Calcitonin is responsible for lowering blood calcium levels, and so it's going to stop osteoclast activity. It's going to promote osteoblast activity and help dump that calcium into the bones. So they don't quite do exactly the opposite in terms of what they do, but the overall function is opposite in that they're either raising or lowering blood calcium levels. All right, and the last one, this is really short. I know it's kind of weird, but I want to keep everything in order. The last thing is bone classification. This just comes down to classifying bones based on shape. So if we're looking at the adult skeleton, it has 206 bones unless someone has an extra finger or lost one. But we have 206 bones in the adult, and these bones can be broken down into 5 major categories based on their shapes. We have the long bone, the short bone, the flat bone, irregular bone, and sesamoid bone. The long bones are just longer than they are wide. We usually see these in limbs. They kind of function as a lever. The short bones are like little cubes. These are good for stability and support. The flat bones are thin. These are good for serving as attachment points for muscles and protection for internal organs, so like the ribs. Irregular bones are called that just for that reason. They don't have a regular, easy to characterize shape. So their shape is really kind of out there. And then the sesamoid bones, these are small and rounded, kind of like a sesame seed could be shaped. And so here we see some examples of each bone classification Grouping, we have the flat bone up top here, the sternum in this case. Right, again, it's nice and flat. You can't see the depth of it, but when you get into the classroom, into the lab, and look at the bones, you'll be able to see it there. We have the long bone, right, again, longer than they are wide. We have the sesamoid bone, so in this case we're looking at the patella, aka the kneecap. You can see it's kind of rounded. We have the short bones. In this case we're looking at the lateral, intermediate, and medial cuneiform bones. And you see they're kind of cubed off. And then the irregular bone, in this case we're looking at the vertebra. It does not have any sort of shape that fits in any of the other categories. It's really in a class of its own.